Well, good evening and thanks for joining us here on News 20. I'm Randy Gardner. We've got a great show for you tonight. Joining me tonight from the American Cancer Society, to my right, we have Christine Winter, Media Director. Glad you could join us. We appreciate your time.
Thank you, Randy. Thanks for having us.
And to your right, we have Deborah Leonardis. I want to make sure I have that correct. And you are the Senior Manager of Primary Care Systems.
I am.
Glad you could join us here this evening.
And thanks for inviting me.
Christine, let's start off first. We've had a great relationship with the Cancer Society for the last 20 years. It's come a long way. We've done a lot of things. As far as anybody who may be seeing this for the first time, tell us a little bit about what your organization does for the community.
Sure, absolutely, Randy. Well, I think what most people think about when they think of the American Cancer Society is the research we do, and that's absolutely the backbone of how we're coming up with cures and early detection methods. But what a lot of people don't know are all the other things that we're doing across the country and right here in St. Louis to help people with cancer, as well as to help people prevent cancer in their lives. And very exciting, last year in May, we celebrated our 100th birthday. So our organization has been fighting cancer for 100 years. And what a lot of people say is, well, why is there not a cure yet? Well, obviously cancer is not one disease, it's many, many diseases. So for the last 100 years, we have actually made an incredible impact in the fight against cancer, thanks to partners like yourself, as well as volunteers and community members across the country. Currently, right now, 2 out of 3 people that are diagnosed with cancer are actually surviving, which is tremendous. And the survival rate is about 90%. So we have definitely come a long way. However, we know that we want to finish this fight. We've had the same mission since we've been around, and that's to eliminate cancer. And so a lot of people say, well, how are you going to go about finishing that fight? And we do it in several ways, through helping people get well and staying well, finding cures, and fighting back. So, we've come a long way. There's been a lot of research done. We've been a part of every major research breakthrough in the last century. 400 people are living today and surviving cancer every day. We want to move that mark to 1,000 people a day, as well as make that number 3 out of 3 people surviving cancer. And we believe we can do it.
When you look at it as a whole, I think if you ask somebody, what is the mission of the Cancer Society? And that's what they think of, to defeat cancer. Right. All the research is being done. But the wealth of information that is on the website and what you can provide to somebody is invaluable, because those are some of the most distraught words anybody can hear in their lifetime is you have cancer. And you're the place they should turn to first.
Right.
There's a wealth of information on the web, but everything, I don't even know how to, through interviewing doctors and everything, they say be careful about what you learn on the web. But when they come to your organization, they know they're getting the facts.
Right, and it is the #1 trusted source of cancer information out there. Another thing people don't know, and I always tell this to friends or family members, or gosh forbid, people we know that are being diagnosed with cancer, our 1-800 number is absolutely incredible. And the reason is because you can call anytime, day or night, and you get a live voice. You get somebody on the other end to talk you through whatever your question is, to direct you to an oncology nurse that they have as well, to find those resources and to help you through those questions when you leave that doctor's office and your head might be spinning. We have somebody and a place for you to go. Along with the website, you can go in and find information on all different types of treatment and just a wealth. I mean, we could have a show just about the information that is out there on our website.
What would you say to individuals about making that first phone call? Because no matter if it's a drug addiction, alcohol, or diagnosis of cancer, that first step is always the hardest.
Absolutely, because let's face it, you're scared, and we say all these statistics about people are surviving, but when you first get that diagnosis, it's very, very scary. And so I would just say, pick up that phone. No question, is just call. It's a voice on the other end that can really talk you through and walk you through whatever it is that you need.
Deborah, let's switch our focus a little bit and
Sure.
talk about primary care systems and how you're involved with the Cancer Society and how it all works together to help reduce the incidence and the mortality rates right now.
Absolutely, Randy. Well, first I want to thank Christine for inviting me, so I truly appreciate that. So Christine talked a little bit about our mission. Recently, the American Cancer Society looked at how we did business, and we knew we had a couple of goals that we wanted to do. We wanted to reach a new audience, we wanted to reduce cancer disparities, and we wanted to make an impact, meaning we wanted to get to patients before they had cancer. And I am also a cancer survivor, so I'm extremely passionate about what we're doing in this role. So out of that came the need that we really needed a new department. Hence came our department, Primary Care Systems. Our goal is to work with community health centers to reduce cancer disparities by supporting their cancer control interventions. So how we're going to do that is we have account reps, and in a minute, Maggie Grodefent, who's your local St. Louis account rep for the American Cancer Society, will be talking to us a little bit about who her accounts are, who her systems are. But let me first talk to you about how the process is going to work. So Maggie is going to call on local community health centers, and we're going to try and understand where are their needs, where can we help them, and then we're going to provide resources. So some resources we could provide are provider and patient education materials. We could also provide evidence-based programs that show, if implemented, they will reduce cancer disparities and increase screening rates. So this is a resource guide that the American Cancer Society will offer to our community healthcare centers, and it speaks about the 4 essentials. And if an office was to implement this, it is shown it will increase their screening rates. And it basically includes a doctor's recommendation, office policy program, a reminder system, and communication. Now, something else that we offer, we've got limited funding, but we do have some funding opportunities. And I'm very happy to tell you that in the St. Louis City area, we actually have 2 grants with 2 of our federally qualified healthcare centers. We have an NFL Crucial Catch grant with Family Care Health Center. They reached 2,500 of their patients, and because of this grant, 220 of their low-income, no-insurance women will get mammograms. We have a second grant with WellPoint Foundation, and that's with Peoples, and that's a breast and cervical cancer grant. They're going to reach 5,000 people, and they will receive 300 breast and 200 cervical. So there's a lot of successes that we're doing with our new department.
When you look at this department and the goal of the Cancer Society as a whole, we talk about the awareness, the website, but when it really comes down to the core of things, it's all about educating people early, because if you can catch this disease at an early stage, it's so crucial in the survival rate. And you look at guys like myself, mid-40s, afraid to go have a certain test. You feel, if I don't know, well, I can't be harmed. But that's the exact mindset you don't want to have.
Right, and I think Deborah's department is so important because we do have all the messaging. You know, people need to get screened for breast cancer and colon cancer, and we know the key is early detection. Catch it early, and your survival rate is so much higher than, you know, having the cancer grow for a long time. And we have these proven screening methods that we know are going to catch that cancer. So what her department is really awesome about is taking that one step further and helping those people that don't have the access or maybe don't know about that message, so we can really ultimately save those lives. So, you know, there are so many people out there that are great about getting their routine screenings and know to do that, but there are so many more that don't. And so this is really going to impact how many lives we're saving. So.
Deborah, as you talked about this going through the healthcare systems and different, what have you found has been the greatest, I guess, reference in terms of somebody's life? Is it a wife maybe putting the husband on the platform and saying, you know, if you don't do this, you could leave myself and the family behind? What would you say to the families out there?
It could be, and I do think to a degree it is that. I also think that a lot of our hospitals, who we also have partnerships with, Siteman, WashU, really are educating their patients on the importance of getting screening for that appropriate patient. So I think it's a combination of family doing a little nudging and our hospital systems doing some really great education, along with our mission and hospital rep folks.
What would you say to somebody and you've got a huge platform right now, about going out and putting that fear behind you of the colonoscopy, of all these tests, that maybe a little inconvenience right now could save years of inconvenience, huge inconveniences down the line.
Yeah, and you actually, Randy, tapped in on something that really is a reality, is there's a lot of fear out there, specifically around perhaps colonoscopies. That tends to be a fear that a lot of people have. I would encourage people to get the early screening because if caught early, some cancers can be prevented. And what I can share with you is that the Washington University PCAD department, Program for the Elimination of Cancer Disparity, really understands there is a fear out there, and they're working towards addressing that with the community and partnering with us so that we can, kind of inch people a little bit forward to getting those screenings early.
When you look at this division, you look at this kinds of references here, basically it comes down to wealth or knowledge as well. I mean, the more you know about something, the less fear you have about it as you walk into it. And that's kind of the goal of this, isn't it?
Yeah. Sure, absolutely. And I think, amongst other things, knowing your family history, what's gone on in your family, and just everyday steps. I just left a corporate impact meeting with a bunch of CEOs talking about what they are doing within their companies to improve health and wellness. And I think there's so many basic steps we can do every day, and that's eating right and just a little bit of exercise, avoiding tobacco, protecting your skin, amongst getting that screening test that you might be fearful of. Just think about the things every day you can do for you and your family to prevent cancer as well.
And you kind of hit on a very interesting topic. You hear it at home, you hear it on TV, but a lot of times you don't hear it in your work environment. What a creative way to kind of work down from management and CEOs to teach it through your work. I mean, it's productivity for your employees if they feel better and they're not in fear of some kind of disease or cancer.
Absolutely.
Have you seen that?
Yeah, absolutely. And especially in the clinical side in our community health care centers, getting that education out there, having brochures available for patients to pick up, speaking with the administrators of the systems, really reinforcing the importance of, not only screening, but nutrition and exercise has been extremely valuable.
As we start to wrap this segment up, I can always tell when I sit down with individuals about the passion they have for what they do. And that's what attracts me to the Cancer Society, is that everybody we deal with has so much passion for the mission. If somebody wants to get involved, they want to find out more information, where do they turn? How do they find out more about what you're doing? Yeah,
absolutely. They can contact me at the American Cancer Society. My direct line is 314-286-8190, and that's Deborah Leonardis. Also, I encourage anybody who does go to one of our local community health care centers. We've got 4 in the city. Please reach out to them to understand how we can help them once they're at their system, but they absolutely can reach out to the American Cancer Society directly.
And Christine, to kind of piggyback on that, as we wrap up this first segment, the next segment, we're going to talk to Maggie more specifically about certain accounts here in the St. Louis area. But what would you want to leave everybody with in terms of this new primary care?
I mean, I think the messages are out there, and a lot of people know, about the awareness screenings. I would just encourage people to pass the word along, to talk with their friends and their family. Like Deborah said, sometimes it's just a little nudge to say, hey, have you thought about this, being the first step. So just think about your loved ones, think about, your future, and we can take steps every day. And again, to call our 1-800 number if you're newly diagnosed or even a caregiver. We have lots of free programs and services as well to help people going through cancer. Well,
Christine, you'll be back in the next segment. Deborah, thank you so much for your time here on the show. We appreciate everything you do for the community. And stay with us. You can always go to cancer.org to find out more information. Stay with us. We've got much more next year on News 20.
I remember the moment.
I'll never forget that moment.
That moment?
It was a moment that changed my life. I'd been training with my team for months, and now we had been called up for the first time. The real deal. Wildfires were getting dangerously close to homes. At that moment, I got my first taste of just how important the Guard is to my community.
See how the Guard can be an important part of your life at NationalGuard.com.
And welcome back to News 20. I'm Randy Gardner. Hope you're enjoying the show with the American Cancer Society. Once again, joining me here at, I always say desk, but I should say set now. Christine Winter, the media director for the American Cancer Society. Thanks for staying with us. We appreciate it.
Thanks again.
And to your right now, we have Maggie Grotefin.
Yes.
Glad you could join us also.
Thanks for
And you
having me.
are an account rep for Primary Care Systems. And one more time, let's kind of walk through, if somebody missed that first part, how Primary Care Systems fits in with the American Cancer Society.
Okay, with the American Cancer Society, obviously we want to reach everyone. And if there are cancer disparities out there, we want to make sure that we're reaching the people that have the most challenge getting their screenings. So by working with the federally qualified health systems in the city, as well as the Boot Hill, we're able to reach out to more of those people that may not otherwise have an opportunity to get screenings.
So when you break this down, it's more or less a branch of the American Cancer Society. It's not a total separate business. It's a part of the society itself.
Right, and I think it's just all about, Randy, recognizing, like Maggie said, we're all inclusive. You know, we're all humans. We all could be potentially affected by cancer. So it's making sure that we're hitting every population that we can to make sure they are getting their screenings to ultimately save the most lives.
And real quickly, before we go on, a website and a phone number for anything that they see or hear today to find out more information.
Sure, absolutely. It's cancer.org. And our 1-800 number is a great way to get connected to the local office, but also ask any questions that people may have regarding a diagnosis or survival. And that is 1-800-227-2345.
We talked in that first segment with Deborah a lot about Primary Care Systems, the function, what it's doing. As far as your responsibilities, you're out there bringing people into this. My word of advice would be don't sit on your heels. Don't wait for you to call them. If you like what you're hearing, pick up the phone and call you.
Absolutely. We have an open door policy. We want to help everyone, like Christine said. So if somebody sees our value and knows that we could help them, please, give us a call. We'd be happy, to talk to them. Currently, I'm out there. I'm doing discovery meetings. So I'm trying to learn about what the facilities currently have and by way of cancer coalitions and prevention. And then listening to their needs. So once I learn their needs, basically taking back what we can actually help, how we can help them through the ACS. So.
And what's some of the feedback that you receive, both positively and negatively?
They're very excited that we want to be on board with them, and we're happy that they're willing to partner with us as well. We're hearing a lot about the barriers to how people are, to screening. In the city, we have the barrier of transportation. It's not always easy for the members of the community to get to their facilities to get these screenings. We have the fear of what happens. A lot of these people are trying to find out what their next meal is going to be. So cancer screening's not on the top of their mind. So we're going to work with them to try to help with these barriers, try to get more reminders out there to let them know that, hey, this is important. There are programs available that can help you and get you in to get these screenings. So.
You can't turn on the television. You can't read the paper. You can't really do anything this day and age without hearing the word cancer. You can almost beat people over the head with the information, but still people are afraid. That fear word is so crucial. How do you overcome it? I know this is something you guys deal with every single day, but how do you overcome that fear without picking them up and actually putting them on the table to have the test?
Well, I think it's different for everybody, obviously, but I think the message is screenings and prevention can save your life, and education is power. I also think it takes the whole community together. It takes the awareness from the American Cancer Society. It takes the primary care physicians and the clinics out there urging people, and you start hearing that message over and over, and knowing that it's not a death sentence anymore. Like I said earlier in the show, we've been around for 100 years, and the amount of progress that we have made, 2 out of 3 people are surviving, and we will get to 3 out of 3. We need people to take action and to, again, learn about their risk factors and what they can do to be a part of that and to be a part of finishing this fight, so.
Now you guys hear these stories firsthand. What's the general feedback from somebody who maybe waits and says, I was fearful, and now they find out, you know, they have stage 3 cancer or 4, and they say, I should have done it. Do you hear a lot of that?
Absolutely. I think we could have a show of some survivors sitting here telling their story of the difference that it made and why they waited, or you know, maybe they watched a family member go through it, and so that's caused them to take action where maybe they wouldn't have. So the stories are absolutely powerful out there of what people have been through and the message that they have, and we have, I mean, we operate because of our volunteers, as you know, through Relay for Life and our other events. So just talking to people and their stories, they're so powerful, and they're so willing to share a lot of times the experience they have to help other people not end up in the same situation.
And later in the show, we'll talk about some of the individual activities that individuals can get together and work together with, like the Relay for Life. There's so many things that you guys do year round. But Maggie, let's talk about the whole feeling. I talked in that last segment about passion amongst the people who work with the Cancer Society. What's it like for you to know that when you go to work that, you know, it's just not a job, that you are actually changing and saving people's lives?
It makes it a lot easier to get up in the morning. You know, like Christine said, everyone has been touched by cancer in one way or the other. And I've only been with the American Cancer Society for 2.5 years, but I have learned so much about cancer. And like Christine said, education is huge. So to get out there and empower people and say, you know, if you get your colonoscopy, you can prevent colon cancer just by getting your colonoscopy. You know, prior to this, you know, I had parents that got colonoscopies, and they would say, oh, I found a couple polyps, no big deal. That's actually a very big deal. Those polyps are what grow into cancer. So the fact that they got their screenings, it actually saved their lives. So just knowing that we can get out there and educate people, and I'm a true believer. I mean, I hope to God one day we don't have jobs because they find a cure to cancer. That would be the best thing ever.
That was going to be my next question, actually. Are you reading my notes? No, is that, you know, the ultimate goal is to put the Cancer Society out of business. And you, right at the beginning of the show, touched on something that you hear all the time, is, will cancer be eradicated? And if I, as the general public, ask you that as the experts, will it be, do you think, in our lifetime? Will it be another lifetime? Or will things continue to kind of come up that we continue to fight? I know it's a very hard question.
That is a very loaded question, but like Maggie,
but I guess I'm looking at the strides that have been made over the past 10, 15, 20 years and where we are now in the fight against it.
I mean, just if you can look back and think back of some of the things that have happened, like smoking, for instance, right? You could go anywhere and smoke. You could smoke on an airplane. It was American Cancer Society research that actually found that link between smoking and lung cancer. And now you can virtually go anywhere and things are smoke-free. So we know that you know, that deterrent is helping people quit. We know that quitting is extremely hard and difficult. So just the fact that, you know, over more than half the country is smoke-free, you know, that lung cancer is the #1 cause of cancer deaths. So just strides like that, strides in research. Our research program actually funds innovative young researchers who have not yet had enough experience to be picked up by a larger governmental grant. So the money that we raise to go to these researchers with these innovative ideas, I mean, just talking to a couple of them and hearing how excited they are over their work and what that could lead to, I absolutely believe that through the research and the more research that we can get funded, like that will fund a cure. And for example, this past year in 2013, we had something called the Cancer Prevention Study 3. We actually enrolled 1,800 participants across the St. Louis area into this study. This study, funded by our intramural research department down in Atlanta, will follow these people over 20 to 30 years. Every couple of years, they'll get a survey about their lifestyles and things that have changed. So what's going to come out of that? The second study, Cancer Prevention 2 that we did, so many different things came out that we were able to now know, you know, base different medicines on. So these studies are happening right now, and I don't think a lot of people realize how much is going on, and we just can't do it fast enough, you know. But certainly, I truly believe with the research and the knowledge that is out there, hopefully someday we will get there.
And as we wrap up the show in a few minutes, we'll give out the numbers and all the information where people can find out more information. But things throughout the year with the Cancer Society, Relay for Life is one of the staple events throughout not only the St. Louis area, but the entire nation. What are some other things that go on throughout the year?
Well, Relay for Life, you mentioned it's a great event. Not only is it our bread and butter, it's our largest fundraiser. It is also a great opportunity for cancer survivors and caregivers to come and celebrate, and it's really a great emotional support group as well. We also have a wonderful walk every fall in Forest Park called Making Strides Against Breast Cancer. We have a gala event if you're into, coming to a gala. It's a cowboy western theme, Cattle Barons Ball, that's held in November, so that's a fun event. Obviously, volunteering for our many, many programs is an awesome way to get involved. We need our volunteers. We talked about barriers to treatment. We have a wonderful program called Road to Recovery, which is you're a volunteer driver and you pick somebody up and take them to treatment and bring them back home. Huge life-saving program. So there's so many different ways. We have our Hope Lodge. You can come down and serve dinner to some of the guests who are staying in town for free at our Hope Lodge while they receive treatment. Just so many ways to give back, both of your time and monetarily, that are definitely going to move the mark and help us get to our goal.
And Maggie, once again, before we wrap up, let's touch on what the primary care systems portion of the Cancer Society is doing for the community.
Okay, well currently I'm working with the Family Care Health Center here in the city, People's Health Center, Grace Hill and Myrtle Hilliard. We've had meetings with them so far, and we're trying to do interventions, trying to make it easier for them to reach those, like I said, patients that can't get in to get their screenings, and maybe help them get some policy in place to make that happen. I'll also be working with Comtria Health Center in Jefferson County, Kreider Health Center, Family Health Center of Boone County, and Great Mines Health Center, and then also down in the Boot Heel, we'll be talking to Southeast Missouri Health Center, Missouri Highlands, and Cross Trail. So we're going to try to help all these folks, find ways to get these people in to get their screenings and hopefully to save more lives.
So as we hear some of the names and some of the counties and areas that are being served, just to let everybody know, the Cancer Society here in St. Louis is actually not just focused right here in the area. Takes up a big portion of the region.
Absolutely. Our physical buildings here, but we are in every community, serving communities. Again, so many people out there. What's going on in my community? Well, research. It might not be happening at a facility in your community, but you're certainly benefiting from it, as well as, like we mentioned, our website and 1-800 number, as well as our patient service center. That's another great way for somebody who's just diagnosed to have a continuum of care in terms of you call, you're diagnosed, and these people can walk you through your whole treatment until the end to get you what you need and get you connected in your community.
And last question for you. For everybody who sat and watched this for the half hour, they're learning maybe for the first time about, hey, I can make that call, I can find out that information. What do you tell them about getting off the couch and getting those screenings and learn as much as you can?
I would just say it's, for the benefit of obviously you and your family, and we can prevent this disease. It's just learning, how to do that and taking that first step, whether, like you said, it's the phone call or talking to your doctor, hey, I'm this age, what can you do for me? What do I need to do? What do I need to do to get screened for certain cancers? So,
Christine, we appreciate your time. Certainly appreciate what the Cancer Society does for the entire nation. Thank you for your time.
Thank you for
we appreciate
having
it.
us. You're a great partner.
And Maggie, thank you so much. We appreciate your
Thank you.
too. Once again, you can go to cancer.org to find out more information, or you can call the local St. Louis number that's been on the screen throughout the show. Appreciate your time here on News 20 on GTN tonight. Have a great evening. We'll see you tomorrow night.
I remember the moment.
I'll never forget that moment.
That moment?
It was a moment that changed my life. I'd been training with my team for months, and now we had been called up for the first time. The real deal. Wildfires were getting dangerously close to homes. At that moment, I got my first taste of just how important the Guard is to my community.
See how the Guard can be an important part of your life at NationalGuard.com.